the Joint Prevention and Control Mechanism of the State Council. General Secretary Xi emphasized that we should always stick to the general policy of preventing imported cases and domestic resurgence and keep dynamic zero policy. We always put people's life and safety before everything else. And also we should advance economic and social development, and we should minimize the impact of COVID-19 while boost the economic development. In the recent week, we have seen the curve going up in terms of the confirmed cases. 40% of the cases located in our neighboring countries, which means we face a mounting pressure on preventing imported cases. Domestically, we have seen that multiple outbreaks in multiple places with a wide coverage dominated by Omicron, which means we have a quite severe situation at home. COVID-19 response is one of the top priority, and we should never lower our guard against COVID-19 prevention and control work. We should always stay vigilant and should always practice our normal prevention and control measures. And we should also make sure that ODA measures should be implemented in a meticulous and consolidated and sound manner, and make sure that this cases will not spill over to other places, and also to clear the local clusters. And we should also make COVID-19 response in an accurate and precise manner, and also to protect the people's their daily needs in the restricted lockdown places. And also our measures should always be science-based. And for everyone, please always practice the normal COVID-19 measures, and we should conduct a solid war against COVID-19. As of March 18, the total confirmed case, the vaccination, around 3.21 billion doses. 1.3 billion people finished their 2 doses. And today we'll continue our press conference to brief you about the COVID-19 response in a meticulous and sound effort. We invite Mr. Lei Zhenglong from Health Committee, Madam Jiao Yahui, Mr. Zheng Zhongwei from the Vaccination Working Group, and Mr. Wu Junyu, Chief Epidemiologist, and Mr. Li Xinwang from Ditan Hospital. And they will answer your questions. Now the floor is open. Please identify your media affiliation before raising questions.
谢谢中央广播电视总台记者提问。想请问的是，大家都比较关心这几天
CMG CCTV, my question is really in the public interest. We would like to know what changes has happened in a bigger picture of China's COVID-19 situation. Thank you for your question. Right now, the 4th round of COVID-19 is still surging around the world, and right now it's at a very high level. And right now, we have more than 20,000 cases reported. Recently, in Jilin, more than 10,000 cases reported. The other 4 provinces reported more than 1,000 cases. For the other 10 cities, reported 100 cases. Right now, we are at the curve that's still going up, and we have seen this round of COVID-19 as the multiple outbreaks in multiple places, and we conducted a swift NAT and also conduct our epidemiological investigation work, and also we identify the restricted and controlled areas, make sure that we always stick to the principle of dynamic zero, and there is no large-scale resurgence of COVID-19. Thank you.
谢谢主持人。新华社记者提问，请问现阶段在病例数仍在较快增长的情况下，国内疫情防控的重点
At the current situation, we have seen an increasing number of confirmed cases. So what are the most difficult work? Maybe the question to Mr. Wu Zunyu. Thank you for your question. The current COVID-19 situation is quite severe, and our top priority of COVID-19 response can be divided into two parts. One part is the places with confirmed cases. These places need to first curb the further spread of the virus. And the other part is for the places without confirmed cases. Their job is to prevent new cases emerged, especially the high-density places like schools, prisons, nursing homes. These are the places with a high density of population. So the most difficult part of our work is that for all the people contracted with COVID-19, how we can screen them out as soon as possible. Because once we find them, we can quickly curb the spread of the virus because they provide very important information. So we emphasized really need to do things in a swift manner. We need to run ahead of the virus. And second means that we need to cover them all. So along the transmission route, we need to find all involved personnel. Make sure there's no risky people left behind. Because if we left one risky people behind, they could be a new source of transmissibility. So we can get help from big data. During our epidemiological investigation, big data play a key role in clearing and drawing up the whole transmission route, so help us to screen out the whole related personnel along this chain. Another is we talk about the city-wide NAT testing. It's very important because it's a very timely manner and also cover a full city or a full area. We talk about in a certain area, if we conducted this regional-wide NAT, it's better to finish all the tests within 1 to 3 days. So fast, fast, fast is the key word. We talk about you should do it fast and also make sure you cover all people, all residents in this area. So if we can do the NAT covering all people in this region and in a very swift manner, and after 3 to 4 rounds of NAT, we can basically screen out all potentially risky people. So we always mention that no one left behind. So you should cover everyone in your targeted places. So we talk about you need to cover the full population in the targeted region. Another thing I would like to mention, for each infected patient, their disease is developing. So when you find them, they may be at the very beginning of the curve. So they may show like asymptomatic symptoms or very mild symptoms. In the next edition of the protocol, you could find that for the really mild cases, asymptomatic cases, right now they all stay at the quarantine place. So if the asymptomatic cases or the mild symptom patients, their disease starts to develop, then they need to transfer to designated hospital. I believe if we can do all these, that will be very conducive to control the coronavirus. Thank you.
谢谢主持人。中央广播电视总台央广记者提问。那么本轮疫情呢，
Thank
呈
you.
现点多面广、频发的这个特点。
China
那请问本轮疫情
National
当中
Radio.
医疗救治的
For this round of COVID-19, we have found that multiple outbreaks in multiple places with a wide coverage. Can we know the medical treatment in this round of outbreaks? Thank you for your question. To give you a number, yes, indeed, right now this round of COVID-19, we've seen that the outbreak happened in many places at the same time. It's Omicron. And certain cities, we have seen a very fast growing number of infected cases. Right now, we have more than 20,000 cases hospitalized. Majority of them are asymptomatic patients. Actually, that's more than 95% of the confirmed cases is asymptomatic cases or the mild symptom cases. And for a small number of the confirmed cases is the people with underlying diseases or the not vaccinated. So less than 0.1% patients is the severe symptoms. If you just learned the news this morning, 2 fatal cases happened in Jilin province. These 2 fatal cases, one is elderly people, one is elderly people, one elderly person, another one is also age above 60 years old. So they have quite severe underlying diseases. And also one fatal case, not vaccinated. Their COVID-19 situation actually was mild symptoms. The death reason still caused by the underlying disease. So this is a bigger picture right now for this round of COVID-19 outbreaks. Back to your question regarding medical treatment. We have gained a rich experience in medical treatment, and we have seen the best results around the world in terms of medical treatment. Everything is quite in a very smooth manner. After the next edition of a treatment protocol is released, and we also have the identified or classified treatment, so that emphasize that we identify the people with different treatment. So for the mild symptom cases and asymptomatic cases, right now, they will stay at the either makeshift hospital or quarantined places. So the improved 9th edition of a treatment protocol, we will give them the antiviral treatment. So we have a specific antiviral prescription stated in the next edition of a protocol. And also we collected needs from different provinces regarding the macromolecular medicine against the virus. And we also continue our way of implementing the medical treatment with both Chinese and Western medicine. And if the patient meets the standard of entering ICU, we will also bring them to ICU. And also for patients with high risk, they will also be included in the designated pre-ICU inpatient ward. So make sure that we do everything to prevent them developing to severe cases, and we also sent the experts to different provinces. And for Jilin, we also sent a team of experts to hand on in the disease prevention and control work and medical treatment. So for the patients in designated hospital, that's in our interest, but at the same time, our experts also visit a makeshift hospital So by doing this kind of the makeshift hospital visits, we can find the high-risk patients in just very early time, so we can bring them to designated hospital before their disease developing to a quite severe situation. Right now, our way of treatment is very effective. Thank you.
谢谢。南方都市报记者之前的发布上提到过，我国启动了针对奥密克戎变异株的新冠疫苗的研发。然后请问这项工作的最新进展是什么？谢谢。
We have learned that right now we have already started the vaccination research, specifically targeting Omicron variant. So what's the progress? Thank you for your question. November 26, 2021, WHO officially marked Omicron as an alert variant of COVID-19. 4 months later, Omicron right now is the dominant variant virus. So it's with very high transmissibility and less detectable. Studies show that although that people may still be infected even they finish their full vaccination, but still that's the Omicron not run away from the vaccination, which means if we finished 2 doses of vaccines, that will much more helpful for us to lower the risk of developing to severe cases or even deaths. If we have also a booster shot, then that also help us to lower the risk of contracted Omicron variant. So we can say that right now the vaccines still the very effective way to protect us. Yesterday, WHO also called on everyone, especially the vulnerable group, should get vaccinated as soon as possible. And also recently, we have seen that Omicron make breakthroughs, cause people infected. So everyone is quite keen to know when is the time we can get a shot targeting Omicron variant. I understand that we talk about vaccine. Most important thing is safety. So we talk about vaccine is the good weapon to protect healthy people. And safety and effectiveness are always our top principles. At the very first day of Omicron emergence of Omicron variant, our research team of vaccination already started. Right now, we have seen a quite good progress, and the preclinical research already finished. And right now, we have uploaded the documents of our research, and for the monovalent vaccine and the Delta Omicron inactivated vaccines right now is at the preclinical situation, and also is right now undergone the mass production verification, and also we have the conduction regarding the recombinant protein also includes Delta vaccine, Delta Omicron, and also for the adenovirus, also under the preclinical trial. mRNA Omicron vaccine right now is also at the preclinical work.
目前在境外推进3期临床续贯研究的过程当中，也得到了针对奥密克戎变异株。
And right now at overseas, our research regarding the heterologous COVID-19 vaccination also had quite valuable results. No matter it's Omicron or the other previous variant, our research team regarding vaccines already moved.
用而不备，谢谢。
Our goal is
好，谢谢，请继续提问。
we always have something in hand for emergency uses. We always have something in hand.
第3位女记者，对。
总台央视中文国际频道记者。那我们注意到第9版的诊疗方案指出，轻型病症要实行综合隔离管理。那请问这是出于什么考虑？
At the next edition of treatment protocol, we talk about is a new change regarding the quarantine places. So that will be a one person per room, or that's a kind of the management style like a makeshift hospital. Is there a potential risk of cross-infection in these quarantine places? Thank you for your question. Omicron is a dominant variant. Shows the feature of a high contagious, less detectable. So in a very short time, it can infect a large group of people. But we're looking at from a clinical situation, more than 90% of the patients with Omicron show very mild symptoms, which means all these patients do not need to be hospitalized. So if they not need to stay in the hospital, but they need to be quarantined or stay in the centered places because they still COVID positive. We also don't want to overwhelm our hospital. Then we quarantine them in a designated place. So we have a medical team to provide medical service to this group of people to cure the disease, and also to control the further spread of the virus. So that's all these patients do not need to be one person per room because they infected by same variant. But one thing is that they should be totally separate from the close contacts. That will have the possibility of cross-infection. But for all the people with Omicron virus, you do not need to worry about the possibility of a cross-infection. And also, all these places we practice closed-loop management. As long as the medical personnel protect themselves well and also clear the environment frequently, there's no problem.
你们好，香港电台记者提问，想请问一下，香港这一波的疫情现在累计确诊的病例突破100万。
Hong Kong Radio, my question regarding the situation in Hong Kong right now, the confirmed cases surmounting 1 million. So how you access the current situation of COVID-19 in Hong Kong SAR, and whether it's necessary to carry out a city-wide NAT, and also we need to conduct the flow of population. Thank you for your question. Yes, indeed. As every one of us in the motherland very concerned about the situation in Hong Kong SAR. And the good thing is that the situation in Hong Kong already reached the peak and right now show the decline. Although we still have seen 20,000 to 30,000 new cases reported, still the situation very grave in Hong Kong SAR. And the central government attached great importance to the situation in Hong Kong and also give support to Hong Kong SAR, support the Hong Kong executive government by sending a medical team to Hong Kong SAR. And also the current goal is to lower the number of confirmed cases, lower the number of hospitalized personnel, and lower the number of fatal cases. And also the elderly people are at the center of our work as well. Based on the motherline's previous experience, nucleic acid test is a very important way to find the potential infected personnel, especially in the community level. But that should depend on the capability of all supporting facilities. We have every reason to believe that in Hong Kong, as the AR government, will do everything they can within their capability to do a good job in controlling COVID-19 situation. And also from our side, we will do everything we can to help Hong Kong control the spread of the COVID-19. Thank you.
谢谢主持人。中央广播电视总台财经节目中心记者提问。那在此前的国务院联防联控机制新闻发布会上，多次强调要保障这个疫情期间群众正常的看病就医需求。
We've mentioned many times that we would like to maintain the normal hospital service, especially in the places that's locked down. Is there any policies we have or manners we practice in this manner? Yes, indeed. To fulfill people's normal medical service needs is also one of our key priorities. So we talk about state control or restricted lockdown places, people actually infected in terms of visiting hospital. From year 2020, we started to learn the lessons and also to have the practice in this field, and we asked the hospitals in their emergency room, operation room, and wards need to have a buffer zone. So this buffer zone is to accept patients without the COVID-19 results or waiting for their COVID-19 results. You should not take any excuse, especially you ask people to show COVID-19 before they could receive the medical service. They should COVID-19 results, test results should not be a showstopper. So in the next edition of treatment protocol, we also better allocate the medical treatment resources. So you ask the question especially regarding the last mile or last meter problem. We should first focus on the group of patients that need to receive that regular treatment, like the underlying women, the elderly people or people with tumor, or the people need to do dialysis. We should guarantee their medical needs. And also we open the online channel, so for the patients, if they can visit doctors online, so they can get their prescription. So to deal with people's last meter problem, we need to deal with the halting back home situation. So for the patients need to visit hospital, especially the patients in restricted or lockdown places, we need to open a channel for them, because we know lockdown is that the patients or people, anyone, residents in the lockdown places, they should not leave their home, their door. And for the people in restricted places, they should not leave their community. So we need to think about the way to open the channel for the people, the patients in restricted and lockdown places to receive medical service. And also we ask hospitals to have a buffer zone to receive the patients. Once again, COVID-19 testing results should not be the excuse to turn people away. For the people in a severe situation, and we also can assign 120 emergency ambulance to deliver these patients to the hospital, or maybe we have the chartered cars or the volunteers vehicles to transport people from their community to the hospital, and also we need to think about the way they back from the hospital to their home. So before, a lot of places may just think about how we send these people to hospital. So at the same time, you also need to think about how you can get people back to their home. So we have already had some good practice. So for the restricted places and lockdown places, first you need to learn the knowledge of your patients in your places. So you know exactly what they need, and then you can match. And also report the situation to the local authorities. And we talk about the tumor patients where patients need to do dialysis. You need to know exactly how many of them has these medical needs. Then we can have a really precise a match between demand and supply. Thank you.
谢谢主持人。中国日报记者提问：那据媒体报道，世卫组织专家最近证实，
China
多
Daily.
个国家都发现了德尔塔克戎毒株。
According to the media report, the WHO official shows that the Delta Crohn, so this is a new variant emerged.
我们应该如何应对？
So how you
好，我们请吴尊友
access
先生来
this
回答。
newly combined variant?
谢谢这位记者的提问。
I invite Mr. Wu to answer your question. Thank you for your question.
新的毒株的这个
In recent days, yes, WHO confirmed a new variant emerged. So which means that one patient contracted two variants, Omicron and Delta. So these two variants combined together. Right now, these combined variant, Delta AY.4 and BA.1 Omicron 1. So the immune bodies to Delta and the sub-protein shows Omicron feature. Right now, these Delta Crohn variants found in European countries. It's around a dozen cases. From the epidemiological investigation or clinical symptoms, it shows quite clear symptoms as the patients with Delta or Omicron. So we just found it, and there's very few cases. So you talk about this new feature of this variant, or whether the current vaccine is still effective. So far, we don't know yet. We not have sufficient information. Right now, WHO is working with relevant countries by putting a very close eye on the situation, and will made the alert to the global community in a timely manner. So the new variant has been keeping emerged in the recent 2 years, no matter it's Delta or variant or the newly emerged variant. Our lessons shows that our disease prevention and control measures still can effectively curbs a large-scale infection. So for us, we need to do three things. First, vaccination. If you're not vaccinated yet, please do so. If you're not received your booster, please go to get your booster. Vaccination is the basic work of COVID-19 response. And second, as regarding our normal practice of COVID-19, so wearing masks, keep social distancing, keep your personal hygiene, washing your hands, keeping regular ventilation. All these measures are very effective to protect ourselves away from the virus. And third, we should also pay attention to the situation of COVID-19 and also for our working places, our living places. You should always comply with all these COVID-19 response in different places.
谢谢主持人。人民日报记者提问：请问其他不同技术路线疫苗研发最新进展情况如何？谢谢。
好，我们请郑中伟先生来。
I would like to know about the vaccination in different technologies. What's the current progress? Thank you for your question. From year 2020, since the outbreak of COVID-19, March 2020, we mapped out 5 technology roadmap of vaccination. So far, regarding vaccination research and development, we are very proud to say we are leading the world in this field. For these 5 technological routes, we have already covered all the clinical practice. So far, we have 29 vaccines entering to the clinical situation, and 26 of them entered to the phase 3. And as you know, 7 received emergency usage were already marketized and also entered to the WHO list, accounting for 20% of global vaccination. 6 inactivated vaccines entered the clinical trial, 12 recombinant protection, and 5 adenovirus entered to the clinical level. mRNA and DNA entered to the clinical trial. Majority of them right now is undergoing the stage 3 of a clinical trial. And people would like to know that whether we very soon have that inhalation vaccination. Right now, that inhalation vaccination right now is under the 3rd phase of clinical trial in the overseas countries. We just released the nice edition. We talk about even the CT number above 35. Then the patients can be released free from hospital. So that means the patient is not contagious. Thank you for your question. I believe that's really in public interest. Well, we talk about if the CT number above or equal 35, actually this is not just coming from no ground. So we now change other indicators. Why we mention the CT number should above or equal 35, which means their sample cannot separate virus, which means all these patients not contagious. We talk about that the patients as COVID positive again. Now we found that the close contact of these re-positive patients actually shows all negative results to COVID-19. So in the rehabilitation stage, just in 1 week, their CT number above 35. So they do not need to stay in hospital. So we change the ACT number. So patient, if they reach the ACT number above or equals 35, and they need to do twice of CT with 24 hours interval. If they reach 2 times above 35, then they can free from hospital. Economic Daily. I would like to know the current situation of vaccination, especially booster shot. Invite Mr. Lei to answer your question. Thank you for your question. According to a plan made by the Joint Prevention and Control Mechanism, and our vaccination work should be conducted on a voluntary basis. And we improved our work in educating the public and also promoting the knowledge of vaccination and make sure that all the vaccination work can be conducted in an effective and smooth manner. As of March 18th, the accumulated number of vaccination is above 3.21 billion. More than 1.2 billion people received vaccination. Among them, 1.29 billion people finished the 2 shots. Around 644 million people finished their boosting vaccination. 221 million people above 60 years old finished their doses. Accounting for 80.27% of the total population vaccinated. Still, vaccines are the most effective way to protect people's health and safety and lower the risk of developing to severe situation. Still, we still have work to do to increase the number of vaccination among the population above 60 years old. So if anyone eligible, and please receive the booster shot. Thank you.
好，我们来请右侧区第4排第3位女记者。
好，谢谢主持人，我是澎湃新闻的记者。有个问题就是最近发布的第9版的整个方案里面提到了2个最新获批的
In the next edition of protocol,
这2个药物目前我想问一下
we found that the 2 antiviral prescription. So for these 2 medicines, that's already used in the clinical treatment, and how that changed the whole disease development, and what's the price of these 2 medicines, and that bill should be covered by the government or by person, by the patient. Thank you for your question. Yes, indeed, these 2 medicines are already included in the newly released edition of protocol. So for these 2 medicines, a key goal is to help a patient, prevent them from developing to severe situation. And based on our previous clinical research, the results shows that the patients after with the disease in 5 days, it has a possibility to develop to severe cases or has higher risk of death. And then the hospital rate and the death rate is muchly decreased by receiving these 2 medicines. So it meets our needs. That is why we included these 2 medicines into our protocol. I believe that will be very helpful for us to lower the death rate and hospitalization rate. Thank you.
谢谢主持人。中国网记者提问：由于疫情常态化长期性，不少民众产生了倦怠期。对于
We talk about the COVID-19 is the enduring nature. So Right now, the temperature is going up, and people may lower their guard against COVID-19. And people do not want to wear masks because the weather is increasing, the temperature is increasing. So what we can do? We have been dancing with COVID-19 for more than 2 years. We all know that COVID-19 cannot disappear in a shorter time, which means it's an enduring company. We cannot change the fact. Then we need to change ourselves to cope with the fact. So this is the reality. So we have a very strong heart and strong mind. We adjust our expectation and get ourselves ready to go along with COVID-19 for an enduring time, and also make sure we can also adjust our way of life and way of work against the background of COVID-19. In the past 2 years, we have already achieved a substantial results in controlling COVID-19. We talk about our testing agent can show us the result in a faster manner, our vaccination, large scale of marketing vaccination, commercializing vaccination, and also medicines. These are all the effective weapons for human beings to kill the virus. With the advanced technology, human beings will eventually win the battle against COVID-19.
谢谢中评社记者提问。新冠肺炎诊疗方案修订，轻型病例实行集中隔离管理，普通型、重型、危重型病例以及有重症高风险因素的患者在避免医院治疗。为什么要分级收治？无症状感染者是否会归类到轻型病例中？谢谢。
That we bring the asymptomatic patients to the quarantine places. The patients with confirmed COVID-19 results will be hospitalized. Why we conduct this clarified treatment or hospitalization policy? To answer your question, first, judging from the reality, as well as our research on the previous virus variant, we have found that the feature of Omicron is high contagious, fast transmissibility, but less detectable. But for the majority of the patients, more than 95% of the patients actually is asymptomatic symptom or mild symptoms. So one thing, because for this high number, 95%, is that a large number of people already vaccinated finish their 2 doses. We talk about for the people with this virus. So we could bring them to the hospital or designate the hospital, and we have mentioned a policy of a classification. But one thing we need to mention that for people with pneumonia, they should be hospitalized. For the patients with the asymptomatic symptoms or mild symptoms, they're not hospitalized, but they are in a centralized place. So for this kind of facility, they still COVID positive. So a centralized facility should be totally separate from the places for the quarantine for close contacts. We talk about the quarantine places or centralized facilities, but they should be separated because one group COVID positive, one group COVID negative. So for this group, we bring them to the makeshift hospital. So we talk about although their situation is quite mild, that doesn't mean that there is no a medical personnel on site. So why we bring this group of people to makeshift hospital is that for the mild symptom, they still have the possibility, or they still show the symptom like a fever or a nasal obstruction. So we still need to give a treatment, including Chinese medicine and Western medicine, so that there a specific treatment based on each case, and they should also under a close monitoring. If the patients show the symptoms of worsening, then they should immediately transfer to the designated hospital. So this is consideration of a classification treatment. Regarding asymptomatic cases, these group of patients shows no symptoms. So in the next edition, for the previous treatment, the protocol actually not treated the asymptomatic cases as patient because they show no symptoms. But still, these group of patients COVID positive. So they should also be controlled in one place. We not treat asymptomatic symptoms or asymptomatic cases as mild cases. It's different, but they need to also be under a centralized management. So some asymptomatic patients still at the outside of the disease or at the very beginning of their disease. So very soon they may develop to mild symptom. So they may still in the incubation period. So that is why they should be all controlled together. Phoenix TV. Regarding centralized management of the mild symptoms, so what's the process? So they should be first confirmed as the COVID-19 positive cases and then transferred to the makeshift hospital. Thank you for your question. One thing is clear. And we do not need to bring the COVID-19 positive patients to the designated hospital and then transfer them to the makeshift hospital. We do not need that process. 95% of the patients are only mild symptoms or asymptomatic cases. So if the testing result is positive, then first we bring them to makeshift hospitals. But for people with high risk elements like elderly people or people with underlying diseases or pregnant women or children or people with smoking history, or people with obesity, then they will brought to the designated hospital. For the patient with pneumonia or showed pneumonia symptoms, then the coughing or fever. So they show these kind of the symptoms. So they will be also transferred to the designated hospital. So we talk about how we can find the patient in the makeshift hospital, but they already show the symptom worsen than mild symptom. So we have a portable CT device for the patients showing very obvious pneumonia symptoms. We give them a CT scan to further identify whether they with pneumonia or not. If yes, then they will be transferred to designated hospital. And we also have the expert team. They will conduct the touring visits to these makeshift hospitals. The experts with rich experience can also help identify the patients with high possibility of developing to severe situation. Due to the interest of time, 2 more questions, please.
谢谢主持人。封面新闻记者提问，请问为什么说老年人接种疫苗意义重大？
Cover news.
接种和不接种新冠病毒疫苗的差别有哪些？谢谢。
好，我们请郑中伟先生
Why
来回答
we
这个问题。
always push elderly people receive COVID-19 vaccination? Why they are very important to receive vaccination? Thank you for your question. The necessity of elderly people receiving vaccination we have mentioned so many times. Yesterday at a press conference of the State Council, we also answered the question. I would like to also give you more information to once again emphasize that we should increase the vaccination rate among elderly population. Just now, Mr. Wu and our other speakers already mentioned about how we can effectively guard against COVID-19. So we talk about testing, we talk about quarantine, that is the way. And we talk about cutting the route of transmission, and wearing masks, quarantine practice, keeping social distancing. It's all very effective. And third one is to protect the vulnerable people.
疫情防控的工作来看，实际上我们可以看到，凡是违背常识、违反原则，
During the past 2 years,
承受巨大的代价。
if anyone
最大的代价就是生命的
go
丧失，
against the principle,
尤其是
then we should bear a bigger price.
生命丧失。
And the highest price
新冠
pay
病毒是一个
may
新病
be a large
它
number
全人
of
群
death toll.
而在这个易感人群当中
COVID-19 virus
最脆
is
弱
a
的
new virus, which
就是老
means
人。
all population are
因为老人
susceptible
往往大都
people.
有基础疾病，
And
同时他的免疫力
one of the most vulnerable group
一旦发生感染，
is the elderly
相较于
group,
成人和儿童
because majority of
那
them
么它的
with
重症和
underlying
死亡
diseases
是非常高的。
compared to
那么我们
youngest,
国家呢，由于疫情
they
防
have
控得好，
really high
我们没有
risk
这方面的统计数据。
of
那么
developing
我们
to
看看
severe
全球的数据
situation
全球
or
截至目
deaths.
前因新冠肺炎死
If
亡
we're
的
looking
人
at the
数已经超过
global
600万。
number, so far
那么从各个国家报道的数据
more
来
than
看
6 million
平
people
均年龄都在
died
70
because of COVID-19.
按照美国
The
CDC
average
的
age
统计数据，
above 70 years
相
old.
较于18到
According
29
to
岁的人
USCDC,
它这个数据的话是经常
compared
是
to
在变动
the age group
那么
from 18 to 29 years old,
到
the number
65
is
到74 岁
the
人群的住
dynamic.
院风险提高了4倍，
So compared to the
死
A
亡风
number,
险提高了65倍。
so the
75到84岁的人群，相较于18到29岁的人群，住院风险提高了8倍，死亡风险增加了140倍。85岁以上的人群，住院风险
so this is a comparison between the age group
死亡风
between
险提高了340倍。
18 to 29 and to 75 to 84 years old. That the a number of hospitalization is 140 times compared to the younger group, and the a death toll is 221 times.
没有接种疫苗者的死亡率是1.25%，两者相差
And the
30%。
number showed in Hong Kong SAR,
而在香港报道的死亡人员当中，90%以上。
the a death toll
所以由此可见的话，
90%
接种疫苗对于降低老人
elderly
的
people.
重症和死亡率是有效的。在这里我还有一个数据
Vaccination
和大家分享。大家知道阿联酋
is a very effective way to lower the hospitalization ratio and the death toll. UAE is the very first country to give us green light as June 2020 to conduct a phase 3 clinical trial. So for a country with more than tens of millions population, as of the beginning of this year, the targeted group shows 96% of vaccination and near 55% booster shot vaccination. And 70% of the vaccines from China. From January 1st to March 17 this year, the COVID-19 situation is still raging in UAE, but you could see that just within months, just 9 people died because of COVID-19. So vaccination are very effective to protect people, especially the vulnerable group, elderly people. So people always worried about whether the vaccines are safe enough for the elderly people. So the elderly people worldwide receiving Chinese vaccines, more than 100 million. And the highest age is 106 overseas, and also the same age at home. Adverse effect actually is even lower than the number among young population. So all these shows that vaccines are safe enough for the elderly group. A lot of elderly people think that I'm not doing a lot of outdoor activity or I'm living in very remote places. I have really low possibility of contracting with COVID-19 virus. Actually, this is a very risky thinking. You could see that right now the Omicron is wreaking havoc. A lot of asymptomatic patients emerged. If these asymptomatic patients back home, they bring the virus to the elderly people. So we talk about that one case. That's a grandson with asymptomatic symptoms of COVID-19 and visit his grandma. Unfortunately, he brought the virus to his grandma. So that is why we talk about our plan of vaccination. It's the first we conduct the vaccination to the targeted group, the risky group, and then to the larger scale of young generation, and then to the kids and to the elderly people. So still right now the vaccination rate among the elderly population is comparatively low. If we want to surmount the guard wall against COVID-19, then we need to do everything we can to increase the vaccination number among the elderly people, so that can also buy more time for us to controlling and preventing to control and prevent COVID-19. So we emphasize so many times that it's very important and also do good to each household, to each community, and to the country at large.
您好，中国青年报记者提问：目前现在一些学校发生了聚集性疫情，请问儿童和青少年该如何做好防护工作
So we have seen a cluster of infections happened in schools. How we can better protect our kids?
谢谢这位记者的提问。
Invite Mr. Wu to answer your question. Thank you for your question.
没有接受这个新冠疫
For
苗接种的
people
人，那么对于新冠病
not
毒呢？
infected COVID-19, for people not vaccinated yet, they do not have that the immune system against COVID-19 virus. So they actually have a possibility of infection. If the kids have close contacts with COVID-19 positive people, they have the possibility of contracting with COVID-19 virus. So the protection measure actually for kids and adults are all the same. Vaccination is first and foremost, and then always practice COVID-19 measures like wearing masks, keeping personal hygiene, washing hands frequently, keeping ventilation, and also in schools, keeping social distancing, wearing masks. These are the normal practice. On top of that, if the younger people in fact, COVID-19, it always shows less symptoms. So they sometimes not have even the feeling of sick. So we talk about at schools. We should always put a close eye on monitoring symptoms so we can find the potential infected students, so we can curb the spread of the virus at a very early time. At today's press conference, the invited guests show us the current situation of the COVID-19 situation in China, and we talk about we should always follow the science-based methods in practicing COVID-19 response. And we will have more pressers to give you updated information.